All right, well, good afternoon, everyone. Before I get started with the update today, I just wanted to take a quick moment to talk about my friend and former Senate colleague, Jack Hill, who unexpectedly passed away on Monday. As I've said throughout the last few days, Georgia has lost a gentle giant. Jack Hill is a public servant and chairman of the Senate Appropriations Committee. As you all know, he was respected and loved by countless Georgians across this state, in this building, and certainly in his local community. Earlier today, I signed an executive order directing flags to fly at half-staff this Friday, the day of his service. I'd like to ask all Georgians to lift his family and loved ones and colleagues up in prayer as we all continue to grapple with this big loss for our state. This afternoon, I'm again joined by Department of Public Health Commissioner Dr. Kathleen Toomey, Georgia National Guard Adjutant General Tom Carden, and GEMA Director Homer Bryson. As always, I want to thank these hard-working Georgians and their staffs who are on the ground right now for their tireless efforts in this fight. We are fortunate here in our state to have the best and brightest leading this charge. Today, we're reporting a total of 9,901 coronavirus cases in our state, and I'm certainly continue to be saddened by the loss of life. 362 Georgians have now lost the battle with COVID-19. I'd like to ask all Georgians in every corner of our state to join me and our family to continue to pray for the loved ones that have been directly infected by COVID-19, and for so many Georgians that are hard battling this evil virus right now. During this sacred Holy Week, we must stay united in this fight against the coronavirus. And I want to thank the millions of Georgians who are following the health guidance and helping us truly flatten the curve. We are continuing to make great progress. I also want to thank the frontline workers who are sacrificing every day to keep us safe, our first responders, law enforcement, doctors, nurses, medical staff, public health employees, and many, many men and women who are doing this heroic work. Please keep praying for their safety as well as their families. Many of these frontline workers are unable to see their families during the fight against this pandemic. And while I'm encouraged by some of the recent data, we still have incredible challenges before us. Yesterday, I had a call with our Agriculture Commissioner Gary Black and other agricultural leaders to reaffirm our unwavering support for Georgia's largest and oldest industry. COVID-19 is hitting our state hard, and it's impacting our farm families in a number of ways. First, much of the demand for Georgia farm products is from our schools and our food service industries. With schools shuttered and many restaurants scaling back, our farmers are seeing prices plummet and their demands diminish. Farms that use our country's seasonal worker programs are also seeing amazingly good crops this year, but now they have even more limited markets to sell them in. However, these same farmers are still on the hook for paying 75% of this contract work that they signed up for before the COVID-19 ever hit our state. As you can imagine, coming off generational losses from Hurricane Michael, this is another gut punch for our farmers and our farm families. In the coming days, I'll continue to make the concerns known to our federal partners and ask them to keep our farmers and ag producers at the top of their mind when crafting a Phase 4 stimulus package. Rest assured, we will continue to fight for Georgia's agriculture industry and the families who feed and clothe the world from right here in the Peach State. Now more than ever, I hope you will join me in supporting our farmers and agribusiness leaders by purchasing Georgia-made and Georgia-grown products. Every purchase matters, and every dollar spent provides relief. There is no doubt that COVID-19 continues to impact other industries and workers as well. Thousands of Georgians are out of work, and we have started to see the effects on our state safety net, especially when it comes to unemployment benefits. I want to thank Commissioner Mark Butler, our Labor Commissioner, for all of his great work along with his team members. He is literally doing everything in his power to get out of work Georgians the funds that they desperately need. It's amazing that his team has processed a record number of unemployment claims in the last 2 weeks. They are literally working around the clock to meet the needs of hardworking Georgians in a timely and efficient manner. Earlier this week, I asked Vice President Pence to check on federal guidance for self-employed workers, gig workers, and 1099 contractors from the U.S. Department of Labor, so that here in Georgia, Commissioner Butler can approve the provided funds. The Vice President assured me he would do so, and I certainly look forward to receiving the necessary guidance from Secretary Scalia and the U.S. Department of Labor in the near future. As you know, I ordered that all Georgia's K-12 public schools would remain closed through the end of the year. As a parent of 3, please know that this decision was not easy, but it is incredibly important as we work to keep our students, families, and communities safe. Since that announcement, my staff has been in constant communication with educational leaders across the state, and we have worked with State School Superintendent Richard Woods to help districts prepare and students adapt. In the coming days, Superintendent Woods will partner with my office and launch a working group to develop guidelines and best practices for our schools involving meals, distance learning, facilities and equipment, mental health, and professional learning. We will do whatever it takes to continue to support our educators, our students, and our parents during these challenging times. This month, we have taken some big steps in the fight against COVID-19. General Cardin and the Georgia National Guard have deployed to several long-term care facilities to clean and mitigate coronavirus exposure. The Guard now has 36 infection control teams and has completed missions at 67 facilities in just the last 6 days. These teams have allowed the Guard to assist between 7 and 10% of all our state's nursing home facilities each day. Once we reach 100% of these facilities, the General is prepared to start over and do it again. To provide more assistance to General Cardin, his team, and our long-term care homes, I'm taking new executive action to protect our state's most vulnerable citizens. As we mentioned previously, the Centers for Disease Control and Prevention has determined that older adults, people of any age who have serious underlying health conditions, and certain other groups may be at higher risk for complications from coronavirus exposure. The Georgia Department of Public Health has determined that COVID-19 is spreading through nursing homes, inpatient hospice, assisted living communities, personal care homes, immediate care homes, community living arrangements, and community integration homes. We have dramatically increased access to resources to these facilities to mitigate exposure, but we have more to do to protect these Georgians. Earlier today, I signed an executive order extending Georgia's public health state of emergency through May 13, 2020. This measure will allow us to deploy more resources to communities in need, lend support to frontline medical providers, and keep preparing as we brace for potential patient surge in healthcare facilities. I appreciate Lieutenant Governor Jeff Duncan, Speaker David Ralston, and the General Assembly for working with us to ensure resources are available to proactively respond to this COVID-19 pandemic. This afternoon, I also signed an executive order mandating more aggressive infection control measures at long-term care facilities across our state. I'll outline a few of the key requirements. Facilities must adopt infectious disease transfer protocols with nearby hospitals. Visitors and non-essential personnel are strictly prohibited except in compassionate care situations. If feasible, these facilities must provide in-room dining services and all group activities be canceled. Employees must wash or sanitize their hands after any interaction with a resident. Facilities must implement protocols to screen residents for fever and respiratory symptoms, and employees must be screened before starting a shift. If an employee is exposed to the extent feasible, he or she must self-quarantine for 14 days before returning to work. Facilities are required to implement universal and correct use of personal protective equipment, and we stand ready to coordinate the delivery of those supplies. Facilities must utilize hospital-grade disinfectants for frequent cleaning. If possible, residents with symptoms of respiratory infection need to be placed together, and facilities should have specific employees working only in the affected units. To ensure compliance, I'm empowering the Department of Public Health, National Guard, and the Department of Community Health to issue directives to facilities to prevent, monitor, and treat COVID-19. Today, I'm also signing an executive order to activate an additional 1,000 National Guard members to assist in the COVID-19 emergency response. In accordance with public health recommendations, I'm also extending the statewide shelter in place through April the 30th, 2020. Again, I'm extending the statewide shelter in place through April 30th, 2020. All of the provisions of the statewide shelter in place order will remain in effect. I want to thank everyone who has followed these directives. I certainly applaud your patience. I've also heard the concerns of many hard-working Georgians across our state, including local elected officials who fear that our state is becoming a vacation destination. As a result, in accordance with public health guidance, I've also signed an executive order to suspend short-term vacation rentals across Georgia. To stop the spread of COVID-19, no vacation rental shall occur in Georgia starting at midnight, 11:59 p.m. on Thursday, April the 30th. The term vacation rental means any transaction to lease or license residential property for residential or vacation purposes, facilitated by a third party or a broker for 30 days or less between a corporation, partnership, person, or other entity and private person. There are a few exceptions. This order does not include hotels, including extended stay hotels, motels, campgrounds, or purely commercial transaction. This order does not include any vacation rental which has been fully paid and executed or agreed to before 12 a.m. on Thursday, April the 9th. It also does not apply to leases for property to be used for someone's primary place of residence. All state, county, and local law enforcement are authorized to enforce this order, but at no time shall law enforcement or any other state or local official be allowed to dispossess or evict occupants of a vacation rental. This action is one of many steps that we are taking to keep people safe from this dangerous virus. Expanding access to testing remains a top priority for the Coronavirus Task Force. In addition to the USG testing partnership with the state lab, there are several new private sector partnerships throughout our state. That includes the new CVS drive-through facility at Georgia Tech, which is able to test 1,000 individuals per day at full capacity. And we are excited to announce that the Department of Public Health will begin a partnership with Ipsum Diagnostics, who recently received FDA approval. Ipsum is able to test 2,000 specimens per day and will be able to expand capacity in the very near future. Testing will begin tomorrow at specimen collection sites across the state. Ipsum will provide results to those tests within 24 hours. Thanks to the university system, CVS, and Ipsum partnerships, the state will dramatically increase daily testing. This expansion does not include testing currently available through private sector labs. In addition to their work on testing, University System of Georgia has also provided housing to traveling healthcare workers in the Albany area. While these brave men and women are putting their lives on hold to serve our state, it is the very least we can do to show our gratitude and support. Later today, Chancellor Wrigley, General Cardin, and I will issue a call to USG staff encouraging those who are medical and public health professionals to sign up through the Medical Reserve Corps. I encourage all Georgians who qualify and are able to please volunteer. Last week, we announced an investment of $72 million for an additional 296 beds. Capacity is being added at Phoebe Putney Memorial Hospital's main campus and Phoebe North, at Eastside Medical Center in Snellville, and with 4 temporary medical units which will be strategically placed across our state. We have also charged our state's hospitals, who are literally on the front line of this fight every day, to identify additional surge capacity within their systems. I'm pleased to announce that Georgia hospitals have identified hundreds of additional ICU and med-surg beds across the state to respond to COVID-19. I look forward to sharing more details on this plan in the coming days. Additionally, the state, working under the leadership of General Tom Cardin, is working on plans for even more additional surge capacity in sites across the state should further capacity be needed. But we cannot take our foot off the gas. We've got to continue to keep working, and our task force is doing that around the clock to meet the pressing needs and future needs that we may have to honor those we are serving. We continue to remain hunkered down and prepared for any circumstance that comes our way. In closing, I want to take just a moment to thank all of our partners. It would be impossible to list all the Georgians who are working so hard every day in this fight. I want to thank the Trump administration, the coronavirus task force members, all of our first responders, law enforcement, the many, many healthcare workers, hospital administrators, the association, local elected officials, Lieutenant Governor Jeff Duncan, Speaker David Ralston, members of the General Assembly, Atlanta Mayor Keisha Lance Bottoms, our many faith leaders across the state, our private sector companies who have just done heroic things in our time of need, and all of the hardworking Georgians who are out there making personal sacrifices as we speak for the greater good. I also want to thank my wife Marty and our 3 daughters. They have been my rock during these uncertain times that are unprecedented. I know many families feel the same. As you can imagine, all of those on the front lines are working long hours, and our families are certainly seeing the brunt of that much of the time, and we are all grateful for their love and their support. As governor of this great state, I'm honored to be serving right now in these tough times. And we have had obstacles, and I know that there will be more. And there will be no shortage of challenges that we will have to overcome in the days ahead. And sadly, as we have said many times, there is no playbook for this pandemic that we are facing in our state right now. But we will continue to use data, science, and the advice of our healthcare officials to guide our steps toward a safer, healthier, and more prosperous future in our state. In closing, again, I want to thank every single Georgian, the ones who voted for me and the ones who didn't. And I want to let them know that I'm working hard, not to do what's popular, not to do what's best for my politics, not to do what is easy, but I'm working every day as a husband, a father, and a proud Georgian, as well as your governor, to do what is right. I want to ask for your continued patience and your prayers, because we are all in this fight together, and we are going to emerge stronger together through this fight. Thank you, and God bless you all.
Yeah, sure. Governor, thanks for doing this. Mayors and county commissioners have all pleaded with you to close down beaches and state parks. So have North Georgia commissioners. They think it's sending a message to tourists to come on down, that it's fine. And many are worried about mixed messages, citing comments from your chief of staff urging Georgians to head to the beach or to state parks. What do you say to them? How do you reconcile those competing messages?
Well, I think, there's a lot of messages out there in today's world. I've been in conversations with a lot of those folks. There's a lot of people that have a lot of opinions about all these different orders, but I know they're doing exactly what I'm doing. They are doing the best that they can to keep their local communities safe, and I'm doing the best that I can to keep our state safe. I think part of the problem was people didn't understand exactly what it meant that we were going to keep state parks open and have our beaches accessible. It doesn't mean that we're open the beaches up for spring break parties or the Friday afternoon before the July 4th weekend. And I've had many of those conversations. And I've also talked to many residents of our coastal areas and other places that are glad that we have those outlets for people to get some exercise, to get some fresh air, to do it in the right way through social distancing. I have made that decision based on my discussions with Dr. Toomey, but I understand their concern. That's one reason we went ahead today and did the ban on short-term rentals. I think there was a lot of concern about people coming that didn't need to be traveling. I've heard that concern. But the fact of the matter is, in our beaches and state parks, there's people on social media that are posting videos literally from July 4th. And there's people posting videos of something that happened 2 or 3 months ago that hasn't been happening since the order is in place. I'm getting detailed reports multiple times throughout the day. I've been on a conference call every night with Commissioner Williams from the Department of Natural Resources, Colonel Vowell, members of their team. We know exactly how many people are on the beaches at different times of the day, checking state parks, looking at parking at our area boat ramps. And if something gets out of control and Georgians are not following the directives and social distancing, then we'll shut those down in the future. But right now, people are behaving. And this in many ways is like a water balloon. People wanted me to do a shelter-in-place order. We got to the position where we felt like we needed to do that. But when you start closing, gyms and fitness centers, you push somebody somewhere else. And having, I think today or over the weekend, the max we had on the beaches at St. Simon was 300 people. Well, if you ever been on that beach, that is not many people on the beach. There's people exercising. We're not allowing chairs. We're not allowing coolers. We're monitoring the campground. So if a family goes to camp out during this madness, which I could certainly understand people wanting to do, getting their kids out of the house for some fresh air, they're staying in their campsite. We're monitoring that. If they get to where they're gathering, we're going to shut them down and make them leave the park. But the truth is, we didn't see that last weekend. We're going to continue to have law enforcement on the ground, and I want to thank DOT as well for their signage to let people know, about the rules that are in place. And if something gets out of control, I'll take action to shut down specific, parks, boat ramps, or whatever. But right now, we're not seeing that, and I want to urge all Georgians to continue to follow the rules and help us with that.
Governor Kemp, or maybe Commissioner Toomey, can you talk about, there are reports of nursing homes in Athens and Pelham that have recorded large numbers of deaths. Do we know how many people have died in nursing homes, and can you talk about how the executive order you signed today might improve that situation?
Yeah, let me just give some brief comments. We have been talking about the concern for nursing home, long-term care facilities for many weeks now because we know it's a vulnerable population. We've had General Cardin's team, the public health epi team. We asked CDC to come into the Albany situation because of what we saw down there with the super spreader issue that was a hot spot that ended up probably because healthcare workers got infected, then went into the nursing home not knowing they were infected early on, and you have a whole epicenter down there, and Dr. Toomey can speak to that. But that is why we're taking even more action today. You know, General Cardin's team has been working for days now on the sanitary issue part of it. We've, you know, stressed to the associations and the facilities about the CDC guidelines, but they have healthcare workers that are going down now. So one of the things that we're working on in addition to the General Cardin's team is how do we deal with that issue. Those plans are in the works, and for the specifics on the numbers and probably some more follow-up to the recommendations that are in the executive order, I think Dr. Toomey could probably better speak to that.
Thank you, Governor. One of the reasons why we felt this executive order was so important is that we were recognizing that we were having many cases in these facilities with the highest risk individuals, and that many of them get sick and also may die, also reflects the fact that some of them have underlying health conditions. And for example, in a hospice, someone is in a hospice because they have underlying medical conditions. And so the approach here is not just to wait for a case to be reported or for our local public health team to be notified and go in and begin to test, but to very proactively have our staff, our state and local staff be engaged together with Department of Community Health team, together with General Cardin, to go into all nursing facilities, not just those that have been identified as having a patient or a staff person who's been ill, and not only test individuals, but also, and perhaps even most importantly, ensure that infection control practices are understood, and we can keep reinforcing that and teaching that, and can keep reinforcing those messages as we go in on a regular basis. Our public health teams throughout the state are ready to do this and are actively engaged in this work. And we're basing this response on our experience in Albany and elsewhere, where our epidemiologists, along with CDC epidemiology team, went in and identified that there was lack of consistent infection control being observed. And so we see this as an opportunity to be proactive in this area, not only where there have been cases, where there have been problems identified, but also where there haven't, and to ensure that no new cases occur. That's, I can't give you the exact numbers. I don't have them right in front of me. We can share that.
More than 20, more than 50?
I mean, in terms of individuals.
Individuals in nursing homes and other senior living facilities who may have died?
Oh, I don't think it's that high, but I don't have that off the top of my head. But we have, you know, cases reported, and I can look at that and get that to you later today if you like.
Dr. Toomey, I've got a couple questions. I'm sorry. The first one is some states have released demographic information about cases and deaths by racial group and ethnic group. Is that something that the state is tracking?
No, I'm glad you asked that question, because if you look on the website now, there is the racial information there. Okay. And we have been collecting it all along. It just hadn't been posted. Now that is included. What you'll also find, though, that particular variable is missing in many cases, and it's simply not included in the lab report. And now that we recognize that it's not being consistently reported on the lab report that gets reported back to us, we are actively working with providers, lab providers and medical providers who do testing to ensure that that is included, so that we can have a better picture of what that looks like. I was going to say the best data we have are for those who are hospitalized, obviously, because those are being done in the hospital. But we, yes, have that. That's started to be posted at noon today and will continue to be posted. And we think as we move forward, particularly as we are ramping up our testing, and now 29 test sites around the state run by public health and in partnership with CVS and others, that we'll be able to get better and better data on that. But we are seeing also that there's a potential need for additional information, the demographic data, and I have my team right now working on trying to develop in a proactive way a dashboard, as it were, of additional data, and we hope that we'll make that available in the coming weeks.
Are African Americans having higher rates of cases and deaths?
We're certainly seeing higher rates in places like Albany, and we're seeing some higher death rates, again, looking at Albany. But because the data are so inconsistent, we have as many as 60% of our cases without that racial data. So it's hard to make a firm analysis without consistent data, and that's why moving forward, and particularly as we have increased our testing capacity and recognize that this is a deficit, we will get better and better data as we go along. But it is on the website now.
One other quick question. Do we have, are you all making any kind of reports on the number of healthcare workers who have been infected? Do you have any data on that?
We don't collect those data as part of our case reporting, and we get anecdotal reports from the hospitals themselves. And I would turn to Homer to see if GMA collects that data through their hospital engagement. But that's something we get reported anecdotally, but not in a consistent way as a case report.
Thank you.
Governor Kemp, you mentioned you're keeping track of the inventory of medical facilities and beds and equipment, supplies, constant inventory you're continually making. Have you been in touch with the Army Corps of Engineers and their offer to the states to build field hospitals, to transform existing structures and facilities into field hospitals as one option of expanding capacity in the state? And one other follow-up is, where are we in the projection of the peak being perhaps April 20th, 21st? Where is this state in preparing for that with the hospital inventories, medical beds, and ICU beds we have right now?
Well, let me give you kind of the high-level comments on that, and then I want to let Director Bryson speak directly to supplies and equipment, because I think it'd be good for Georgians out there to know exactly what we've been doing, how much communication we have, what we're purchasing, what we're sending out, and how we're doing that. And then I'd like for General Cardin to speak specifically, because he, along with Director Bryson, are directly working with a lot of people in my administration on the hospital bed surge capacity. That is a moving target, John. I mean, it continues to change daily now that we have, quote, models that we can follow. But also, it's good to have the models, but I want people to know I don't fully trust the models, because we have other issues that we're dealing with in our state that we need to build in extra capacity for. I think when you think about what we're seeing in our long-term care facilities and other things that are out there, I'm sure every governor across the state's dealing with those issues in different kind of sectors depending on how their population is and what their state looks like. And I think comparing Georgia to Florida is a good example. Very different communities when you think about a lot of the resort retirement communities versus the diversity of communities that we have in our state. But we are literally working on that issue and have been 24/7. Our people have been putting out very long hours to try to use multiple data points and models to let us know what that surge capacity is, how much of it we're going to need, and whether we need to look at facilities like the Army Corps, facilities that we can do ourselves, resources that we have in our state. But mostly what we've been working on over the weekend, and I want to thank the Hospital Association and all of our hospitals, our hospital administrators from all over the state that have worked tirelessly with us to identify existing assets that they have in their brick and mortar buildings right now, or old shuttered facilities that we could stand up in a very quick time. A good example is Piedmont, and Kevin Brown, the CEO there. We have moved up their open date on their tower 4 months by cutting through government red tape, permitting issues, and a lot of other different things where we can get those. I think it's like 80-something additional rooms. I mean, that is going to be huge for us in the metro area should we need it. That was that was something that really wasn't on our radar that they brought forward. That hey, we think we can do this. We did the due diligence, and now we got that baked in along with the $72 million 296 bed plan that I mentioned in my remarks. But with that, I'll let Homer speak to supplies from ventilators, PPE, the Corps, and then General Carden can talk about what his group is doing that we're going to hopefully be able to share more information in the days ahead. Homer.
Thank you, Governor. This is a relationship between the state and the federal government when it comes to supplies. It's a unique situation and one that none of us has ever faced before. And to the federal government's credit, they're not using the old models that they've used in the past to how they do business. They've proactively pushed out 3 different allocations to the state of Georgia from the strategic stockpile for supplies. KN and N95 masks, that's over 300,000 masks that have come from the stockpile. Surgical masks, over 900,000. Face shields, over 100,000. Gloves, over 900,000. And ventilators, 100. So they recognize that they've got to be proactive, and so they've changed the model, and they're working very aggressively. We were in conversations with them yesterday, and what they're doing is they're identifying states that are having the hot spots and the issues, and they're going to push resources to those states based on that need. So everybody doesn't get in line and order whatever they think they may need. It's really going to be priority based on the facts on the ground in your individual state. So we think that bodes well for us as a state. Specifically related to ventilators, they've got a model in place that involves the State Department of Public Health, HHS at the federal level, and any time that public health believes that we are within 72 hours of running out of ventilators in our state, then the federal government will make a push to the state to provide ventilators. So that process is working well. We've spoken to over 500 vendors in the last 2 weeks, and we've made significant purchases of PPE to support the medical folks and the first responders in our state. And I'm proud to say that those orders are starting to come in now, and our supplies in our stock in our warehouse are starting to build a little bit. But they don't stay there very long. We brought in materials. We're going to push out just about everything there today. But we've already shipped over 870,000 N95 masks, 1.2 surgical masks, 200,000 face shields, over 3 million pairs of gloves. And we understand that this is a process that's going to continue over the next several weeks. And we've got a lot of folks dedicated to ensuring that we get the materials and that we get them pushed out. And we've got a process with the local communities that's been going for a week now. The system seems to be getting in place. People are getting used to it, and we're hearing good remarks about that. We still don't have the quantities that we need, but it's improving daily.
Good afternoon, everyone. I'm Major General Tom Carden. I've been tasked by the governor to compare anticipated hospital bed requirements with capacity. As the governor mentioned before, there's a lot of thanks to go out to the Georgia Hospital Association, hospital CEOs, chief medical officers. We put together a joint interagency public-private team at our headquarters at Clay National Guard Center, and many of these aforementioned entities have actually put staff in our conference rooms to help us get after this problem. The only hard numbers that we have to deal with is hospital license capacity and what hospitals tell us their capacity to surge to is. Now, as the governor mentioned, there are a number of models that we're looking at. All models are wrong. Some models are useful. So we look at the models that we believe are useful. Those that have been cited by CDC and the White House are among those. And we're taking a look at essentially the worst day in Georgia. And we make those recommendations with respect to where we can build capacity, as the governor mentioned, within brick and mortar, and where we may need to build surge capacity outside of brick and mortar. But at the end of the day, the governor's guidance to us has been very clear and unambiguous. And that's to make sure that no Georgian suffers for lack of not being able to get to the level of care that they need. I believe that we put together a team to achieve that goal, and I'll be happy to take any specific questions you might have in respect to that.
Governor, thank you again for your time today. Quick question following up on PPE. A critical care nurse at Northside Hospital said they are running out of masks. Is 300,000 enough if we're talking about one specific hospital running low?
Well, I'm gonna answer your question with a final comment to the discussion we just had. The other thing that we're measuring every day is what's really happening on the ground in our hospitals. I mean, I've spoken to countless hospital CEOs. I talked to Scott Steiner by text earlier today, asking him what they're seeing on the ground. Things are, Albany is definitely still a hot spot, but the hospital is now managing because they've had a lot of the area hospitals, Jim Matney and Moultrie and other folks that are taking patients. And so not only are we getting daily data from them on what they're seeing on their bed capacity, and what they've seen is the COVID patients is continuing to increase, but their non-COVID patients continues to decrease because they're not doing a lot of these surgeries they don't need to. Other people are like, I'm not going to the hospital unless I'm really sick because of the COVID issue. So it's opening up some bed space for them. That is a great thing for our state right now. So we continue to monitor that every day. And we hear a lot of stories about the PPE. I had a guy that texted me the same type message as the nurse that you mentioned. I think it was yesterday, I believe. It was either yesterday or 2 days ago. I sent that to Homer. Homer's reply was, I think it was on Monday, and Homer's reply was, we had a shipment go out to them on Saturday. So, look, the supplies, as Homer said, we wish we had more of a stockpile. I know the nation wish it had more of a stockpile. The world wish it had more of a stockpile. You have literally, 159 or so countries that are trying to find PPE right now. And that's why I really applaud what the Trump administration and Vice President Pence is doing and the way they have their supply chain network set up, because they know the supply is tight and they're managing that, 72 to 96 hours before states need it. That is why the data that we're collecting from the hospitals and that we're sending to Dr. Burks and her team so they can really know where the next hot spot is going to be, where the one is today, so they can stay ahead of it on shipment. So, when the supplies get tight, we hear from frontline healthcare workers like that. My answer to that would be that I believe that we're doing everything in our power to get that PPE that we have to those facilities before they actually run out. And I believe that has happened every single time. Homer can speak to that if that isn't the case. But that's going to be to continue to what we do. But I'll also, as Homer mentioned, we're not just relying on the federal government. I mean, we're in the market right now. We have literally, have gone all around the world. A lot of Georgians are reaching out to us with connections that they have in different marketplaces all over the world. And we continue to buy what we feel like we're going to need. And I believe right now we're staying ahead of that. As Homer said, I feel a lot better about PPE right now than I did a week or 10 days ago.
Governor, my next question, the state will be receiving a large $200,000 or 200,000 dose donation, I should say, of hydroxychloroquine, obviously to treat patients with COVID-19. Will that also be used or be available to autoimmune disease patients that may be having a difficult time getting prescriptions filled and need that?
Well, I may let Dr. Toomey speak to that because I'm continuing to let the medical experts drive my decision-making on that, relying on Dr. Toomey and public health as well. I'm not exactly sure what that donation was for, but I do know this. There are trials going on, I think, or either some physicians that are prescribing that medication for COVID patients, but there are also a lot of people that use that drug on a normal basis that have had a hard time getting it. And I also know that there's a lot of research going on right now on that medication and whether it would be good for COVID. So I think there's a lot of options on where that drug could go. But I'm going to let the healthcare professionals and the medical community drive that decision for me. And I don't know, Dr. Toomey, if you'd like to add anything.
Real quickly, that donation came through our stockpile, so it is specifically for hospitalized COVID patients. That's the limited window through which FDA has approved it for this purpose. And as you know, I am concerned about the patients statewide that we have with rheumatoid arthritis and with other autoimmune diseases who can't get access to this. And so my plea to physicians is always, please ensure that we have an adequate supply of these drugs for the lupus patients, the rheumatoid arthritis patients whose lives depend on having access to this in our communities, even as we use these medications through the stockpile in a limited way for the hospitalized COVID patients.
Commissioner Toomey, question for you. Thank you guys firstly for doing this. We appreciate it. We appreciate the updates. Our question to you is why did it take 8 days for the State Department of Health to finally report the first COVID death in Muskogee County and Columbus, and similarly in Burke County and Augusta? There's a lot of local numbers, and by the time it gets to the state level, it's taking days, weeks. I know you guys have a lot of numbers. What do you want to tell those departments who rely on your information more quickly?
No, I think one of the things that I've said before at some of our meetings is that these data that we get are the most accurate data that you can get anywhere. However, it takes time to verify data. And social media is very fast and instantaneous. And a hospital may report a death much sooner than we actually get that actual death certificate or other report. So our data are not real time, not for cases, not for deaths. And so that whether it's that death or any other case, you have to recognize that our data are the most accurate source of information, but there is some delay for us to verify everything, including the actual cases themselves. That is public health surveillance. That's the way it works, not just for this particular condition, but for all health conditions. And I think it's sometimes difficult to rectify the fact that our data aren't keeping up with social media or even the press releases of the hospitals themselves.
We've had a lot of people, I think this is for the governor. Thank you. We've had a lot of people reach out to our newsroom concerned that they haven't been able to access unemployment benefits. They're having trouble getting through on the phones or online. What's being done to sort of bolster the response there, and what advice do you have for those who've been trying to get through and haven't been able to?
Well, I would tell those hardworking Georgians, I understand what you're going through. I know it's a very tough time. I will assure you that Commissioner Butler and the team at the Department of Labor is doing everything humanly possibly to, process those forms and paperwork as quickly as they can. It is unprecedented, the number that they're getting in now. I'm sure Commissioner Butler can share some of those. And they told me one day what they normally process versus what they did is a staggering number. But there's also an unprecedented number of people that are trying to get relief right now, and we understand that. We're doing everything we can. I talked to someone that's a hairstylist today that had a hard time getting through, and the reason is they can't process that yet because they haven't gotten the federal guidelines, and that was something I spoke directly on the call. I think it was Monday with the Vice President and the nation's governors, and the U.S. Department of Labor and Secretary Scalia are supposed to be getting those guidelines to us for the gig workers, the 1099 workers, and things of that nature. So as soon as we can get the guidance, Commissioner Butler, he has literally been saying every day to us, look, will you tell them we need those guidelines? Because he knows, and he wants to process those forms. So I would just tell people to be patient, and as soon as we know anything new on that segment of the unemployed, we will immediately get that out.
Governor, this question is from Richard Elliott from WSB TV. You didn't specifically mention churches or houses of worship in your shelter-in-place order. There are some churches, as you know, in Georgia whose members have been cited for holding services and who say they'll hold services again on Sunday. What message do you have for them? And are you looking at doing further restrictions?
Well, I'm going to be speaking specifically about churches later in the week. I want to thank all those faith leaders out there that have taken a proactive position on helping us fight the COVID-19 virus and flatten the curve. There have been many pastors and bishops and reverends and other people that have made some very difficult decisions to, move to online services, to do innovative things like drive-in services, if you will, in your vehicles. Just unique ways to help us flatten the curve. Unfortunately, we've had some that have not adhered to those guidelines. And look, as a faithful person and a believer, I understand how hard that is. If anyone needs to be in church right now praying for wisdom and guidance, it is me, but I'm having to do that in other places. All I can say is I'm proud of the many faith leaders that have made these decisions, who have owned it and have gotten their congregations to go along with it. Many of them have taken financial hits doing this. I would encourage those Georgians out there that are members of those institutions to please remember you can give by the mail or online and support them in this difficult time. But I'm going to speak some more to that later in the week. We just want to continue to have our churches follow the guidance that we have. The last thing we want to do is to go out like we had to do at this church and give citations. But the fact of the matter is, we got complaints. We went out there and asked nicely and dispersed them, and then they were back that night. I mean, that is just, that is not how we need people to operate. We do not want to be the bad guy. We want our citizens to be part of the solution, not part of the problem, and that's what I continue to ask our faith leaders to do.
Are you willing to shut down churches or congregations of worship?
Well, I'm going to speak a little bit more about that later in the week. I hope I don't get in a position that I have to do that, because that is not something that I think I know it's something I don't want to do, but I hope it would be something that I don't need to do.
Hey, Governor Kemp, Tyreek Wynn. I wanted to ask you, since this has been in our state for a few weeks, what are some things that you all have learned as a whole thus far, and how will you guys better prepare if we possibly have something like this to occur again?
Well, I think one of the probably most uplifting things I've learned through this, which is, there hasn't been a whole lot of uplifting things dealing with this every day like we are when you're having to report people that have succumbed to the coronavirus, the heartache of, someone that's lost their job. But I think the good thing that I've seen of this is probably two or three different things. Number one, how resilient our people are, and how resilient this team is right here behind me. People just cannot imagine how hard our public health workers on the front lines are working every day, including all the folks that are in the hospitals and our medical facilities. Just the blood, sweat, and tears that we are pouring in to make sure that we have a hospital bed for every single patient that may need it. What our private sector people are doing, what our Georgians are doing to support their small businesses with takeout, meals, taking donuts and pizzas to healthcare workers. I mean, it's been incredible what our people are doing. It makes me proud to be a Georgian right now. But I've also seen some innovative things. What's happening with our educational leaders? We've been in constant contact with our school superintendents and Superintendent Woods, and what they're doing with distance learning. It's not perfect. Some districts are better than others, but every single district out there is learning, and they're going to be better in the future because of that. How companies right here in Atlanta and across our state are teleworking, and they're figuring out how to make telecommuting work so that they can keep their people employed and keep their businesses running. And many of these are businesses that are fulfilling online orders or distribution networks that we need supplies for these people right now. To me, those are the things that have been, just part of the uplifting things that I've seen every day.
Governor Kemp, considering what we saw with the election in Wisconsin yesterday, have you had any further consultations with Secretary Raffensperger about delaying the May 19th primary?
I have not talked to Secretary Raffensperger lately about, I haven't really talked to him about the election. Obviously, that's a constitutional office, and he's duly elected over there. And like I used to do when I was there, you have to make tough decisions in that office, and I know Brad is working on that. That is, really a decision that he's going to have to make. There's a lot of, thoughts out there on what he, should do or not. And I would ask you to talk with him about his plans for that. I know we got a lot of hard-working local elected officials and poll workers across our state right now that are certainly concerned with holding an election. But I know that's something that he's closer to than I am, and I would just judge his direction on that.
Governor Kemp, 4% of the population of Georgia is Asian American. We've heard the president talk about calling the coronavirus the Chinese virus. I'm grateful that you have not called it that. What do you want to tell the Georgians who perhaps feel that sense of xenophobia, that racism, that really is not what Georgia or the United States is all about? Those who are concerned, what do you want to tell them?
Well, I think if you listen to how the president has talked about that, I don't believe he is that man. I know that for a fact. I would tell Georgians, I think it's a pretty known fact that the virus started in China. I'm not a public health expert, and I'm certainly not a doctor, but my concern is our focus on here in Georgia, and what we're going to do in the immediate future, how we're going to be prepared in the future, and how when we get on the backside of this, we get our economic viability back, that it was good as any place in the country and the world, quite honestly, and that's what I'm focused on.
Good afternoon, Governor. This might be for Dr. Toomey. I'm with the Georgia Recorder and also on the board of the Georgia First Amendment Foundation. And First Amendment attorneys think that there is a freedom to release a lot more specific location data than has been released in the county level, that you could go as low as zip code as South Carolina has without identifying people or running afoul of HIPAA. I was wondering if you could talk about any plans to do something like that.
Yes, I just mentioned that we are working on expanding our website to include more data. Obviously, there's a balance between HIPAA requirements and protections, individual protections, but also the more information we can give the public and our policymakers, I think the better we are in a position to make decisions, personal and otherwise. So we are actually working on that right now, even as we are talking about it, and hope to have something up soon. That first step was simply the racial data, which is incomplete, but also was an important aspect of how we're going to address prevention. I also wanted to note that one of the challenges we're having is that the tests have been coming in very slowly, so we may not even know that a case is a case until even after somebody has been deceased. We're even testing people who've already died to retroactively be able to identify them. All this is contributing to some of the delays and some of the challenges with having the most up-to-date data. These data will never be real time, but the best and most accurate information we can give you, including demographic information, short of violating anybody's privacy, we would like to do that, and we're working on that now.
Governor, do we have any evidence now, since we've had a shelter in place and people are practicing social distancing, that shows that we are beginning to flatten the curve?
Well, I would say that the data, I don't know if this is still the case, but I believe it to be true. When we first started this, people were saying because of the way the testing works and when we get the results back, it takes a couple of weeks to really see what's working and what's not, and that's if you have good data and the right amount of testing. Early on, we certainly didn't have that in our state. I don't think a lot of places around the country had that, and certainly a lot of that focus has gone to the hot spots, as it should have, and we certainly have one in Albany, so we're focusing a lot of resources there from testing on that perspective. It does seem to me, though, that the first order I put in place before the shelter in place, which was a shelter in place for the medically fragile long-term care facilities, you know, social distancing requirements, no large gatherings, closed nightclubs and bars and those kind of things. I mean, we've seen, I think, that data start to get baked in, but it's really hard to say that without waiting another week or so. But, you know, I said in my remarks, we're seeing some encouraging signs, and that comes from a lot of different things. It comes from the Washington model, but it also comes from now that we have better data, even better General Cardin knows than we had on Friday. We have better data today on our hospital bed situation. You know, that has improved significantly. You know, we hope that holds, but that's something that we got to watch for the next 2 or 3 days while we also implement, you know, the $72 million plan for the 296 beds and continue to work on the workforce issues and many other things. And hopefully we'll be able to talk to you here in the next day or two about more details on that. So we're encouraged, but I just don't want to tell people that because we're not sure, number one. I mean, you saw on Monday we had a big spike in all of our data, and as Dr. Burke said in the President's Task Force meeting the other day, they don't really rely on numbers Monday, Tuesday, and Wednesday, because there's a lot of reasons over the weekend things don't get reported on time, or they don't get reported right from where they're coming from on the ground, or the private sector labs aren't open, or whatever the case may be. So, you know, we got to really let the data get baked in and see the trends, and then also have that be lining up with what we're seeing in the hospital, what we're hearing from our public health workers that are on the ground, and, you know, just like we're seeing in the warehouse now. I mean, Homer can measure what's in the warehouse. 10 days ago, there wasn't as much in the warehouse as it is now. So that's the kind of movement we need to see and be able to measure before I can truly answer that question. And I don't want Georgians to take their foot off the gas. There's no question what we're doing is working. I mean, you can just drive around and see that. There are less people out. You don't see people doing large gatherings. I would ask my fellow Georgians that are as concerned about this as I am, if they see neighborhood block parties in their community, they need to call not 911. They need to call the sheriff's department, call the state patrol, you know, call one of the hotline numbers, save the 911 for medical emergencies, but report those to us. And we've gotten a few of those, but we've been able to disperse that very quickly. Most people are not doing that, but it is happening. If you're seeing those, report it, and that will continue to help us flatten the curve, and then we'll know for sure that we're on the backside of this.
Governor, follow-up to that question, when will you know? What threshold are you looking for to know when to lift some of these restrictions in Georgia?
That's a really tough question to answer right now. I think, you know, the president has moved things out to the 30th. That's why we lined up with him and the vice president on the coronavirus task force recommendations. We felt like it's best to keep as much as we can, everybody lined up together, so we're not confusing people. But, you know, when the end is, I think it depends on how people continue to do. If people continue to practice this new norm of social distancing and you know, just staying away from any large gatherings, just be careful about what you're doing, keeping your hands washed and being smart, it'll be sooner rather than later. We're seeing, you know, I talked to Governor DeSantis over the weekend, and he was really seeing some encouraging things, even in regards to what he has going on in the state that was very encouraging to me. Just different things he told me, and I don't really want to get into that because I don't want to be saying something that he's not saying publicly. But those are the kind of things when you just know that it's starting to work, and I think it is, and I'm so proud of my fellow Georgians for everything they're doing to help us with this.
I do have one more from Sandra Parrish over at WSB Radio. She wants you to clarify what it means for people who had short-term rentals who had already paid for it before May 1st. Do they have to cancel? Do you have any clarification?
If people have fully paid, and the press team will correct me if I'm wrong because I don't have my notes here before me, but if people have fully paid, they're permitted. You know, we're not going to take that away from somebody. Anyone else needs to cancel their reservation. In my speaking with most of the folks on the coast, many of the large companies that do short-term rentals, they're not doing short-term rentals in April anyway. They made that decision a long time ago. I do know there's, Airbnb and other folks that have ads up for short-term rentals. We've done some due diligence on that. We believe that a lot of those aren't renting right now anyway because of the shelter in place. But for the ones that are, they will have to adhere to this order. And I think it just gives people on the coast a peace of mind, and also gives the locals the ability to take action on that if that scenario happens and somebody's violating the order. And that's part of the feedback that we got in our communications with folks, especially along the coast, and then also our mountain communities.
Governor, how much money has the state spent on the response thus far, and have we spent through the $100 million from the rainy day fund?
Well, we've spent a lot, but we hadn't spent as much as we could have, because Homer and his team is doing a great job getting what we need, but being frugal in the ways we do it. What that total is, I have no idea. We have a whole team that's okay in those decisions. Homer's got a great procurement team at GEMA that has been through this process so we can get reimbursed. And I think it's good for Georgians to keep in mind the great support that we're getting from President Trump, the recommendations of the task force, and what the Congress has done on the disaster relief packages. A lot of the money that we're spending now, there's going to be federal reimbursements at some level. Most of them, I think, are 75%. Homer can come up and correct me if I'm wrong. But look, we're spending the money that we need to, and we're going to continue to spend the money that we need to keep our people safe, to respond aggressively to this, and to make sure that we have the hospital bed capacity that we need. Now, we are going to do that in a conservative way, but it's not going to hold us back from spending. And we talk about that a lot. We just want to make these spending decisions based on the best possible data, modeling, information that we have, and that is exactly why I have tasked General Cardin and his planning team at the Guard. No one is better than these two guys right here, and I'm very comfortable with what we've been doing.
Governor, I wanted to ask you a question in regards to schools. So not lots of students have the resources to be able to learn online. So do you think that we may see a rise or a big percentage of students repeating a grade for the next coming school year?
Well, I know that is not the intention of our school leaders. Superintendent Woods and I are going to put this task force together, start working on those kind of issues, so I don't want to speak too soon on something of that nature. But look, I completely understand. I heard about, one family that's like, look, we got 3 kids and we have 1 laptop. So, how do we do distance learning? I mean, those are some of the challenges that we have. They are real in our state, but I know Superintendent Woods' team and ours have already been talking about that. There's going to be a lot of resources coming from the federal level because of the disaster that I think will help us alleviate a lot of those problems in the future. And those are the kind of things, we have a lot of ideas. We don't have any plan yet, obviously, because we're dealing with the fight first. But those are kind of some of the things that I think that because of what we know now and having to go through this situation, we're going to be better prepared to address that situation in the future. And I know that we're already looking at that.
All right. Thank you.
Thank you, everybody.